typically when you think of hearing loss, at least I usually think of people over 60, 65, but Diane, that is not the case, is it?
It's not the case. We are seeing more and more hearing loss even with younger ages. So what we're finding that is extremely common, regardless of age. It can affect anyone. And we're seeing the increase in part due to young people using earbuds, listening to their personal listening devices at loud levels. And what they don't understand is listening to loud music today can result actually in hearing loss later in life that's permanent.
And that could start how early in life? You know, if you're doing that as a kid, a young teenager, could that show up in even in your 40s?
Absolutely, yes, because what can happen is it's cumulative. So over time, it's a slow process, can start, as you said, when they're younger, and it's invisible. They don't really see that it's happening. However, over time, it can kind of creep up on them. And what's important to know is that hearing loss is permanent. Once you have hearing loss, it's for good, unlike a broken arm that can heal over time. So using ear protection is very important, and following some of the prevention tips.
So you really need to get through to the parents, I would think, because a lot of the young kids would say, oh, whatever, you know, I'm too young, that's not going to bother me. So the parents really need to listen to this message. Okay, so early signs you're having hearing loss. It may not just be some sudden thing. It could really creep up on you, subtle signs. Tell us about that.
Sure. So sometimes it's just a matter of asking people to repeat more often. Sometimes a person will report that speech isn't clear or it sounds muffled. Turning the volume up on the TV or radio, maybe not even hearing the doorbell, having difficulty talking on the phone. If anyone is experiencing any of those signs, I highly recommend that they talk to their doctor and they schedule a hearing test.
What other preventative tips are there? What, as far as prevention, besides taking out the earbuds and giving it a rest from the devices, what else can we do for better hearing health?
Sure. Well, one more tip that at HealthInnovations that we recommend is to follow the 60-60 rule, which means limiting the use of earbuds to no more than 60 minutes at a time at no more than 60% of the player's maximum volume. So you're really looking at watching how long you listen to the music and how loud for safe listening.
Okay. I was surprised to learn in doing some research for this segment how hearing loss is related to other health issues, such as?
Oh, it really is. I mean, we see even mental health. We see more depression in people that have untreated hearing loss. Yeah, what happens is many times as hearing loss progresses, people will withdraw from situations, and then they feel depressed or lonely, irritable, sad. So we see some of those issues. We've also seen a link with the increase of falling. So Johns Hopkins University has done a study, and they found that even with a mild hearing loss, people are 3 times more likely to fall. And then, of course, those numbers are going to increase as the hearing loss worsens. So it really affects many people in many different ways.
Is that tied in some way also to balance and all of that with your inner ear?
Yep, your hearing and balance are tied together. So when you have a hearing loss, it's harder to really be aware of your surroundings many times.
Interesting. I know a lot of people delay getting treatment, but there is great help out there. I think back to like even my grandfather years ago when he refused to wear his hearing aid. Of course, they were much bulkier then and they would buzz, and it's changed so much. Share the developments with us if you would.
Thank you for asking, because it's an exciting time really in the hearing aid industry. It's ever evolving and changing. First and foremost, cost. You know, historically hearing aids have been so expensive, so that's been a big barrier, but there's been many companies that are making hearing aids more affordable, and HealthInnovations is one of them. So for example, a customer can get a hearing aid for as little as $799 versus $4,000. So that's a huge comparison, a huge savings. We have that. United Healthcare members. Our sister company is United Healthcare.
Okay.
And we insure millions of members here in Tennessee, and they have access also to great reduced discounts. So they can purchase hearing aids for $0 out of pocket and up. So cost is one factor. And then number two, you mentioned, what do they look like? Are they bulky? They're much more sleek and designed nicely. So if it's an issue where a customer doesn't want the hearing aid to be noticeable, you know, they are much more sleek and cosmetically appealing, so to say.
All right. If someone out there is connecting with this topic, going, okay, I think so-and-so in the household has a hearing loss, or maybe they're realizing it's them, where do they get more help and more information?
Sure. Well, they can visit our website, and that's at HealthInnovations.com, and that's HealthInnovations.com. We have information on there. We have articles and tips, so it's a great resource. Or they can even call our toll-free number. We have contracted providers and audiologists. They can receive a free hearing test and at least get that information. And our number is 855-523-9355. I encourage everyone to at least get a hearing test. You'd be surprised at how many people haven't had a hearing test in years, since grade school or what have you.
Any certain age that you should think about having a hearing test, or not specific? There's not a specific
Well,
time.
they say that if there's no symptoms, meaning you're not noticing anything, to start at adulthood, so I guess age 18 and up, every 10 years, and then when you hit age 50, every 3 years after that, if there's no real symptoms. But it's a real good check and balance.
All right, and one thing I want to leave people with out of this segment is hearing loss, once it's gone, it's gone. And so to prevent it is such a key. So that 60-60 rule, I'll take that with me, and I hope the rest of you do too as well. Yeah, thank you so much, Diane, for being with us today.
Thank you.
All right.